I want to bring in my good friend, Dr. Joe Congini, with us this morning, Akron Children's Hospital Sports Medicine Center. And Joe, concussions again in the news, my friend.
Yeah, we certainly don't want to overemphasize concussions, but last week we spoke so hopefully that we were headed in the right direction and maybe patting ourselves on the back a little bit that we had made some changes that were beneficial. And then on the heels of that comes a week that's really, there are a couple of disturbing stories related to concussion that I don't think we can ignore in a segment like this, where we've been kind of keeping people up on the progression of understanding and treating this problem. And there were really 4 cases this week that were pretty disturbing. And the first 2 were ones where the results of the studies of the brain came out. And one, probably the most disturbing of those 2, was the Phillip Adams. He was kind of a journeyman player. He played on 6 different NFL teams, 32 years old. In April, he killed 6 people, including his doctor, his wife, his grandchildren. Oh, gosh, so hard to know that. And the people then really related how much pain he was in, memory issues, mental illness, and they did the results of his brain biopsy for the brain study at Boston University with Dr. Ann McKee, and she found severe CTE in the frontal lobe, maybe one of the worst cases she said she ever found on the postmortem. And so, gosh, still a young man and a really sad story. And then the same week, she came up with the results of Vincent Jackson, who was a little bit of a better player, 38 years old. He was a 3-time Pro Bowler, but he was found dead in February in his apartment, and he also had grade 2 CTE, not as bad, the chronic traumatic encephalopathy, the brain damage. But then even probably more so concerning to me in the last week were 2 concussions that we all kind of saw if you were watching through football on the weekend. Not that uncommon, but Teddy Bridgewater getting knocked out on Sunday. A lot of people ask the questions, why did they cut the face mask off? Why did they put them on a spine board? Obviously, any time, and this is high school, college, pre-high school, that the athlete is totally knocked out, we have to assume the worst injury, assume that it could be a neck injury, assume that it could be a brain bleed, and put them on the spine board, and they have to go to emergency room for further evaluation. And the word is that Teddy Bridgewater is now stabilized and doing better. But the other one from last Thursday night was a tight end for the Chargers, and he went way up. I mean, these athletes are just so amazing, and he jumped high for a ball, came down, unfortunately, on the back of his head, and the TV really zoomed in on him, and the medical team did a great job getting the face mask off. He was obviously knocked out, so they were getting ready to put him on a spine board, and he began having a thing called posturing. And so the body really kind of stiffens, sometimes stiffens in a certain particular posture that they call fencing position. It looks like a fencer. And there's these involuntary arm movements that sometimes follow that posturing that are sort of a seizure-like or can be a seizure-like activity. And so for a lot of people, the fact that the TV audience zoomed in on that, when people saw that, that was extremely frightening to people. But it really was a reminder to us, this is a significant brain injury and can be things like a brain bleed or a structural injury in the brain. So they did a good job immobilizing him and taking him off the field. But then the response to it was, I guess on social media, a lot of different things. But during the game, the person doing the game, Jack Buck, got a lot of criticism. He mentioned that, hey, it was a cool night in Los Angeles. Maybe that's the reason why that would have nothing to do with this. And I couldn't believe it, but I heard on a national radio show earlier this week, I think it was Monday, another broadcaster said, yeah, it was so scary it looked like rigor mortis was setting in. And, of course, that's way off base. So it's probably not best to speculate on some of these things and, unless people know medically what's going on. But it was a very frightening week and really kind of a step backwards of us understanding concussion and knowing that it's still a problem, that we have a lot of of work to do to get some answers.
That's for sure, Joe. And I agree with you. I thought some of the comments we heard in regards to that, and I don't want to say I snickered, but I'm just scratching my head when I heard Jack Buck saying it was cold down there. You could definitely tell that had nothing to do with the temperature. Joe, my friend, thanks for the visit. Have a great holiday season, okay?
Absolutely. Have a great Christmas, Ray, and a great holidays to everybody in your audience. Thank you very much, and we'll talk to you next week.
You got it. Dr. Joe Congini, Sports Medicine Center, Akron Children's Hospital. Always appreciate his time with us Wednesday mornings